And welcome to another edition of Your Health with MU Healthcare on AM 1340 KXEO. Have a special guest joining me this afternoon, and would like you to go ahead and give an introduction for yourself. Tell everybody what you do here and who you are, if you will.
Hello, I am Dr. Uzma Khan. I am an endocrinologist at MU, and I work at the Diabetes Center also at Ellis Fischel. I also have an outreach clinic at the lake that I go there also.
So we're going to talk a little bit about diabetes today, and just wanted to know, first of all, what are some of the symptoms that people might experience if they are diabetic or possibly pre-diabetic?
Thank you for asking that question, because I think especially for pre-diabetes, it's important to know that there really are no symptoms for pre-diabetes. However, we do know that it is common in people that are obese. And there are ways we can check a person, and if they have pre-diabetes, we can actually do something to where they don't become a diabetic. When it comes to a diagnosis of diabetes and symptoms related to that, if your blood sugar is just a little high, you may not have any symptoms. But if it is significantly elevated, a person can have extra urination, especially at night time. They may be thirsty all the time. They may be losing weight. They can get infections, especially yeast infections. So I think sometimes those are the more likely symptoms. But you'll be surprised how many people with diabetes really have no symptoms, and they walk in for a regular physical exam and are detected on that.
What happens if it goes untreated? What are some of the things that can happen to you and your body?
So once we diagnose diabetes, and what we're looking for is a couple of tests. We can check a blood glucose first thing in the morning, which is called a fasting blood sugar, and if it's above 126, and we usually like to check about 2 times. We can also check it any time of the day, and if it's above 200, or we can check an A1C, which is a special type of sugar test, diabetes test that tells us what your sugar has been over the last several months. Based on that, if we diagnose a person with diabetes and don't treat, a lot of people are aware that it can cause damage to their eyes, where they can have bleeding. Over time may even have enough damage to where a person may lose their vision. Kidneys can be affected also, where they may leak proteins or may actually fail over many years, where they may have to have dialysis. Many people are aware of the nerve damage, which can actually sometimes even start in pre-diabetes. And in those people, they have numbness of their feet, and then they will not feel if they get an injury or if they get an ulcer. That can sometimes lead to amputation, where even the toes or sometimes even the foot can be removed because of the infection and the damage from that. A lot of people are not aware of some other complications. These mainly include skin problems, which you'll be surprised how many people have those. They can get skin infections, bacterial infections, as well as fungal infections. They can get to where there's other conditions can be where it affects your stomach, to where it does not empty completely. That's called gastroparesis. And another one is actually mental health. You'll be surprised how many people with diabetes, they may not realize, but they are either very angry. They may be, because they have to check, their lifestyle has to change, or they may be anxious. They may actually be depressed. Sometimes people may deny that they have diabetes. And all of those conditions I consider as complications of a chronic disease that basically we really don't have a cure at this time, but we have mechanisms to control it.
Sure, and that's what I wanted to ask you about next, was once somebody is diagnosed with diabetes, how can they manage that? Does it have a lot to do with diet and sleep?
For that question, I would first like to talk about pre-diabetes. In fact, I would even say just obesity. So we can actually prevent diabetes. We now have enough information based on good scientific studies that if a person has pre-diabetes, where their blood sugar is between 100 and 125, or they have just elevation on their glucose tolerance test, or their A1C is not yet above 6.5, if those people lose about 7% of their weight, which in a person that's 200 pounds is only 15 pounds, and they increase their activity, they may not become a diabetic for many years. So prevention, I think, is the best treatment for diabetes. But once we talk about diabetes, treating it is basically a change over lifetime. And I think the most important thing is the patient realize that they are the one that are in charge. So it's the patient that first makes the change, and lifestyle is the basis of treatment for diabetes. If a person has not modified their eating habits, and that's a discussion for every person with diabetes is different. And keep in mind, when we're talking about diabetes on a show like this, we're talking about type 2 diabetes most of the time, which is in more than 90% of our patients. But there is a group of patients that has what's called type 1 diabetes. Those people need insulin. So they do need the lifestyle modification, which I think is true for all of us, but then they need insulin for treatment. But if we talk about the 90% patients that are type 2 diabetics, for them lifestyle is key. The medicines will not work if they are not doing their healthy eating, and we're talking about moderation. We don't ever say, now you can't eat this, you can't eat that. Just eat things in moderation. And then take your medications as prescribed regularly. We also recommend that you monitor your blood glucose, because I see you every 3 months or 6 months. I do a blood test. What does that tell me? But you see yourself every day. You check your blood glucose. Keep an eye on what makes it go up, what makes it go too much low, because low blood glucose is also very concerning for patients. And then after that, make sure you are following up on complications. And that includes the ones we talked about, also regular visit to assess your feet as well as your teeth, which are very important for diabetics.
I did have one question I wanted to ask you about. Is diabetes possibly hereditary? Is there anything to that?
So we are now having a better understanding about the genetics or the inheritance pattern of diabetes. And what we know is both in type 1 and type 2 diabetes, inheritance is very important. The funny thing is, it's actually more important in type 2 diabetes. So if you look at people that have type 1 diabetes, and if you have identical twins, they have a 1 in 2 chance of having type 1 diabetes. But if they have type 2 diabetes, they have a 3 in 4 chance of getting diabetes. If both parents are type 1 diabetics, the risk goes up a little bit more. But I would say for type 2 diabetics, it's even more important. It has a very strong link to family history. Your grandparents, your parents had diabetes. You have a very high chance of having diabetes, especially if you are obese and not taking care of yourself.
I tell you what, I want to ask you one last question. Are there any breakthroughs, or new technology that's helping out diabetics these days?
There are new things coming out every day. What I want to emphasize are 3 areas. One is in the genetics area. We are learning more about the genetics of diabetes. We also have learned a lot about the antibodies that can predispose you to type 1 diabetes. We are also learning more about the genetics of type 2 diabetics. Okay. The second area would be in monitoring glucose. It used to be where we had these glucose meters, which were not very good meters, and you could never rely on them. Even our glucose meters, where you do your finger stick glucose, have become much more reliable. But now we also have meters that are actually continuous glucose monitors. These are little devices that you just put on your skin, and they have a little cannula that checks your blood sugar all the time. And they actually have become very much better to where they can give you a graph throughout the day, whether your blood sugar is going up, whether it's coming down. We are also coming up with new ways to check blood sugar, and that include ways where you may not even have to prick your fingers or poke something in your skin. So that's something we're working on. There are new insulin pens coming. Most of our patients now that use insulin are using insulin pens. So when we're talking about devices, there are pens that will actually calculate your dose of insulin. One area that has really changed in the last few years are insulin pumps. We now have a much better understanding how to use insulin pumps. We can have the insulin pump to where it talks to the glucose meter or the continuous glucose monitor, and then can even sometimes, if a person is having a blood sugar that's going down too fast to where they're going to hit a concerning low blood sugar, the pump can even stop giving the insulin at that time. So that's regarding the technology. One other thing that's in technology now is what's on the cloud or what's on telemedicine. We can now download our meters, our glucose meters, onto our computers. We can share them with providers, so you can actually bring them with you or even email them to providers. And also we can do what's called telehealth, where you can basically sit in your own room and somebody in a clinic can guide you about your nutrition or discuss diabetes management with you. We do have regarding medications, I think you must have all seen, we have really newer, better medications that target the underlying abnormality in metabolism that can improve a person's ability to maintain good blood sugar control. We do have new insulins that may be available in the future. Right now we have two types of insulins. We have the ones that are long acting, and then we have the ones that are quick acting. You use one at night time, which keeps your blood sugar under control throughout the night time. Then you use the other one just before you eat, so that that peak of blood sugar can be controlled. We have in the pipeline insulins that will actually respond to your blood sugar change. So hopefully those will be available. There are new things about transplants that includes both kidney and pancreas. We are really advancing our knowledge about that. And I think the best way to continue learning more about the newer things in diabetes is by going into clinical trials. We actually have quite a few here at the university, and your audience can reach out to the Diabetes Center, where we keep track of all the trials that are going on. It's good to participate in research studies because that way you learn a lot about yourself, plus you can contribute to improved care for a condition that is really, I think, becoming a big health issue for us. Because keep in mind, we now have 29 million Americans with diabetes, and then we have a lot of people that may have diabetes and don't know about it, or we have people that are pre-diabetics and will be becoming diabetics in the next few years.
Thank you for taking your time out today. Very informative. And you had mentioned the Diabetes Center here at MU Healthcare. A good number for that is 882-3818, as I understand it.
That is correct, and the area code is 573.
Okay. Thank you so much for joining us today, and we hope to visit with you again sometime near in the future.
Thank you very much.
Thank you so much. It's been another segment of Your Health with MU Healthcare on AM 1340 KXEO.